Alright, so I'm going to perform the Ober's, modified Ober's, and Thomas tests. I'm going to use patient-friendly language as if I was talking to my patient in the clinic. So first we'll start with the Ober's test. So I'll have my patient go into side lying on the unaffected side, and I'll just explain to my patient, this is going to test for tight muscles on the side of your leg here. So I'll have my patient at 90 and 90 of hip flexion and knee flexion. I'm going to grab underneath my patient's leg, stabilize at the knee so that there's no unwanted stresses at the knee joints, and then I'm going to stabilize the hip as well to make sure that does not move during the test. I will abduct my patient passively and passively also bring his hip into extension, and then I'm just going to allow his leg to drop. The force of gravity I'm going to allow the force of gravity to allow his leg to drop. If, as you saw there, the leg goes all the way down and touches the table, it's a negative test. Say his leg did not drop at all and it remained abducted or raised up in the air like that, that would be a positive test indicating that he does have a tight tensor fascia lata muscle and IT band, which runs down the side of his leg. So that would be the Obers. If you wanted to do the modified Obers, do the same test, but you just get the patient's leg straight, and that's the only difference. So now move towards, or go into short segment here at the end of the table. Now I'll test the, this is going to be the Thomas test. So I'll ask my patient to grab underneath their leg of the unaffected leg, and I'll just say, well, first I guess I'll first explain what it's testing. It's either going to test for tight muscles that either cross the hip or the hip and knee, which would be the quads or the iliopsoas muscle. So I'll have my patient grab under the unaffected knee, and I'll ask them to slowly lay down on the table. I can help guide this so that he safely is able to do that. And then I'm going to check this angle between the table and thigh of the affected side. A positive test, well, a negative test would be if the thigh is able to rest on the table. A positive test is when the thigh is raised off the table like this. And I just explained to my patient that this could mean that he has a tight quadriceps muscle or a tight iliopsoas muscle. And one way we can differentiate between the two is if I extend the knee, will you scoot back just a little bit, just for the purpose of the video? Okay, so, yep, so one way I can differentiate between the quadricep, the rectus femoris, and the iliopsoas is I passively extend the patient's knee, and then if it's able to lower from there, it points more towards quadriceps tightness because I just put the quadriceps on slack. If it does not lower when I extend the knee, even though the quadriceps is now on slack and it does not lower, that would point more towards the muscle up here, the iliopsoas muscle, being tight. So there you go. There's the Obers, modified Obers, and Thomas test.